Okay, hi, please come in. Hi there. Just take a seat right here. I'm going to assess for patient privacy and room safety, and I am going to sanitize my hands. All right, my name is Toby. I'm going to be your nurse today. Can
Hi,
you
Toby.
confirm your name and date of birth for
My
me?
name is Natalie Thomas, June 20th, 2002.
Okay, great. And what are we seeing you for today?
I'm here for my yearly checkup.
Okay, super. So what's going to happen is we're going to talk first. I'm going to ask you some questions, and then I'm going to move into the physical exam. Okay? Okay. So can you tell me about your past medical history? Do you have any hospitalizations?
No, ma'am.
Have you ever had any surgeries?
No.
Do you take any medications, including herbals, supplements, vitamins, prescription, over-the-counter, anything at all?
No, not on a regular basis.
Okay. Do you have any allergies?
No.
Okay. Can you tell me about your family history? Are your parents still alive? How old are they? And if they have any health issues?
My mom is living. She's 54. She's got a history of hypothyroidism. My father is 52. He doesn't have many issues. He just struggles with restless leg syndrome.
Okay.
Yeah.
That is great. Do you have any history with drug and alcohol use?
No.
Have you ever smoked cigarettes or anything at all?
No.
And do you feel safe in your home?
I do.
You do. Okay. And next, I am going to state that your posture looks good. You are alert and oriented ×4. When you walked in, everything looked normal. You are have appropriate hygiene. You're dressed appropriately. All of that seems great. And now I'm just going to take your vital signs, okay?
Okay.
And to do that, I'm going to start with the first step of a 2-step blood pressure.
Okay.
It's super fun. You'll like it. Okay, just need your little army. Thank you.
My little arm.
Yep. It's gonna feel a little bit snug. Like, bear with me, okay?
Okay.
All right. So first thing is I'm just going to be feeling. So keep your feet flat on the floor, your legs uncrossed, and just no talking, okay? Okay, great. That was stopped at about 130. I will put this in just a moment. Right now, I am going to take your pulse, so I need this hand, okay? All right. You just sit quietly for me. Great. Your pulse is 66. And while we've been sitting here, I counted your respirations, which are 14, which is awesome. And I'm going to take your temperature really quick with my little temperature gun. I just need your noggin.
Okay.
And your temperature is 99.5.
Oh.
Okay, which is well within the normal limits of stuff. And here I'm going to take the second step of a 2-step blood pressure. Okay, really fun. Okay. Gonna get my little listener. Great. Okay. Ready? Feet on the floor.
Feet on the floor.
Good. And that is 117 over 82, which is absolutely perfect. So we can get rid of this. Okie dokie, great. And are you in any pain today on a scale of 1 to 10? 0 to 10.
Probably 0.
A 0 of pain? That is really good to hear.
Thank you.
I'm going to move on to the integumentary portion of your examination. And what's going to happen first is I am going to inspect and palpate your skin just in a normal way, and everything. I'm looking for color, lesions, turgor in the backs of your hands. Your color is appropriate to your ethnicity. You're not clammy. Your temperature feels roughly the same as it was. I don't see any deformities. And now I'm going to move on and I'm going to look at your head, okay?
Okay.
All right, so I'm going to inspect your hair for texture, infestations. I'm going to check your head shape and your head position. And that's all fine. Do you have any tenderness anywhere I'm touching?
No.
Okay, it looks symmetrical. Your hair texture and pattern seems normal. There's no tenderness. So now I'm going to move on to your eyes, okay?
Okay.
Okay, so first I'm going to be looking around your eyes for edema,
Okay.
of which you have none. And next I'm going to be looking at your eyelids for any tremors. Can you close your eyes for me? Okay, great, looks normal, no tremors. And I'm going to be looking at your eyelashes, which are going in the direction that they should. And I don't see any crustiness or sores around either eye, which is great. Now I'm going to be pulling your lower eyelids down and
Okay.
looking at your lower conjunctiva. Okay, can you look up at the ceiling? Color looks good. Great, that is absolutely perfect. And now I'm going to be looking in your corneas. I'm going to shine this really bright light in your eyes, okay? All right, one eye. And both of your corneas are clear, which is great news. You don't have any glaucoma.
Cataracts.
You don't have any cataracts that I can see. All right, so now can you just pull your hair back for me?
Yes.
I'm going to be looking at your ears and feeling them. Okay, they are even, symmetrical, bilateral. Do you have any tenderness?
No.
There's nothing on them, no nodules or anything. Their color looks great. There appears to be absolutely no discharge coming from either ear hole, which is good. Now I'm going to look at your nose and I'm going to feel it, okay? I'm going to push on the bones and the cartilage of your nose.
Okay.
Everything feels great. There is no deviation. Now I'm going to move on to your mouth. So just right now with your lips, they look symmetrical. I don't see any edema. I don't see any lesions. The color is appropriate. Everything's fine. Can you open your mouth for me? I'm going to pull this down. Your gums look like they're normal color. Your teeth don't appear to be missing at all or have any wear. And I want you to open your mouth and stick your tongue out and say, ah, really loudly or really... Anyway, sorry. I'm going to be looking at your, I'm really sorry, oral pharynx and your tonsils. Okay. Okay, great. You have that. And let me just look around. Normal presence of normal exudate. Your tonsils are a 1 grade. The texture looks fine. And I'm going to be moving on to your lymph nodes, okay? So I'm just going to feel around your neck, behind your ears, side of your face, okay? Tell me if you notice any tenderness, well, I will tell you if I notice any swelling.
Okay.
I do not. I'm going to check the lymph nodes back here.
Doesn't hurt at all.
That is great. And none of them are enlarged. So now we're going to be moving on to the cardiovascular portion of our exam. Very exciting. I am going to be listening to your heart in a bunch of different places, so just bear with me, okay?
Okay.
All right. Go up under your shirt, and I'm going to listen at atrial, and pulmonary. T. And mitral. Awesome, your heart sounds really good. I don't hear any of the bad sounds that we would expect, so that seems to be really great. And I am going to need to look at both of your hands, if that's okay. I'm going to squeeze on your fingernails, okay?
Okay.
Checking for capillary refill on both nails. Maybe one at a time. And capillary refill is less than 3 seconds, which is awesome. And you don't have any presence of edema in either of your hands. But now I need to look at your feet, okay? So you're going to just lay down for me?
Take my socks off?
Yes, definitely.
Wow.
Thank you.
Okay.
I'm going to check capillary refill on both of your big toes. It is under 3. I'm going to check your pedal pulses, which are both present, and no presence of edema, which is really, really good. So you can sit back up for me. Sorry to have you going up and down, up and down. So now I'm going to listen to your lungs, okay? So what's going to happen is anytime I place my stethoscope, I want you to take a deep breath in and out, okay?
Okay.
All right. Okay. Okay, I'm gonna go up under your shirt.
Okay.
Awesome.
Sorry.
All right. I'm gonna listen at your back, okay? So if you could just turn this way.
Okay.
All right. Again, anytime I place it, just deep breath in and out. Great. One more time. Good. 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 Great. I'm going to listen at your side now.
Okay.
Awesome.
Okay.
One more side. Great. And now I'm going to feel your chest while you take a deep
Okay.
breath in. Okay, ready? Breathe in. Okay. In and out. Great. So all of your lung sounds are clear. 8 spots in the front, 8 in the back, 4 on each side with equal and bilateral thoracic expansion. Everything looks great. Normal fremitus. All of that stuff is awesome. So now we are going to be moving on to the abdominal portion of the exam. So I'm going to have you lay down again. I'm sorry.
Okay, that's fine.
Okay, dokie. I'm just going to first look at your stomach. I'm going to inspect it, all right? Color is appropriate to ethnicity. I don't notice any bulges or masses. Nothing visibly catches my eye. Normal contour. And now I am going to listen to all 4 quadrants. I'm just going to listen with my little stethoscope, okay?
Okay.
Great. Normal active bowel sounds in all 4 quadrants. And now I'm just going to, lightly press on your stomach, okay? Make sure the camera can see me. Any tenderness?
No.
Everything feels okay?
Mhm.
All right, I don't feel any bulges, masses, and you are reporting no tenderness, so that is awesome. If you could just sit up for me now, again, I'm really sorry. And this is the really obnoxious part of the exam where I have to go through all of the cranial nerves,
All right.
except 1 and 2 are deferred. Look you, I don't have to do those, so we're gonna start on 3, which is the oculomotor nerve, okay?
Okay.
And so to do that, I need my pen light, first of all, and I also need to, first I'm gonna look at your pupils, okay?
Okay.
All right, I'm gonna look at this one, shine a light in it, good. Good. And your pupils are equal, round, and reactive to light. And now I'm going to check their accommodation by having you look right here. And then at that back wall over there. Great, your pupils accommodate just fine. And that is really good. And now I'm going to check your 6 cardinal fields. Can you just follow my finger?
Yeah.
Okay. This isn't a 6 cardinal field, but follow my finger anyway. Okay. Great. Okay. Now it's the 6 cardinal fields.
Okay.
Good. Perfect. Yep. I'm drawing a little butterfly for you.
Okay.
There you go. That was really great. Your 6 cardinal fields were great. So with that, I was testing cranial nerve number 3, which is oculomotor, cranial nerve number 4, which is the trochlear, and cranial nerve number 6, which is the abducens. So all of those, I did the 6 cardinal fields, and they were really great. So right now I need to test 5, which is the trigeminal. So right now I want you to close your eyes for me. Where am I touching?
Forehead.
How about now?
Left cheek.
How about now?
Right cheek.
All right, I'm gonna switch it up.
Left jaw.
Okay, how about over here?
Right jaw.
Okay, that was really good.
Thank you.
You were correct on all of those questions. Could you please chew? Okay. You. Can you clench your teeth for me?
Yeah.
Are you clenching? Oh, are you clenching? Oh, that was the same thing. Okay, that's great. We're gonna move on to facial, which is number 7. Cranial nerve number 7, which is facial. Okay.
Okay.
Can you raise your eyebrows? You smile really big. Can you frown really big? You puff out your cheeks. Okay. All of your facial nerves are a-okay. And now I'm gonna check your auditory nerves. Okay, which are your auditory nerves, and those are number 8. So can you close your eyes? What does this sound like?
Rubbing.
Okay. What does this sound like?
Rubbing.
Wrong. No, I'm just kidding. You're right. Good job. Those are perfect.
Okay.
Okay, I am going to be moving on to number 9, which is glossopharyngeal. So can you swallow for me? Super. That is wonderful. And then number 10, which is your vagus nerve. And let me remember what the vagus nerve is for. Oh, well, you're obviously speaking to me. You've been speaking to me this whole time, and your voice quality sounds great. And I need to look, well, I already looked at your uvula, but I'm going to look at it again, okay?
Okay.
So you're going to go, ah.
Ah.
It is there, and it looks good. Okay, now I'm going to move on to the accessory, which is number 11, okay? So I need you to raise your shoulders against my hands, and then look that way. Okay, and look that way. Great, that's really, really good. Okay, and now can you, I'm going to do the 12th, which is the hypoglossal. So could you please stick your tongue out? Up, down, that way, that way.
I don't care.
Super.
I'm not very social yet.
Okay, I need to check your reflexes, your patellar reflexes. So if you could just sit with your feet on the ground and lift this knee up, and I'm going to bang on it. Good. One more time. Great. Will you just wait here a minute?
Yeah. for
Thank
sure.
you. I will be right back.
I can hear you too on camera. Oh, I'm so sorry. It's okay. Oh God, I forgot. Okay.
Knock, knock, knock.
Hello.
Sorry about that. I'm going to assess for your privacy again and your safety. And I'm going to sanitize my hands. And
Okay.
can you just verify your name and date of birth for me?
Yeah, my name is Natalie Thomas, June 20th, 2002.
Great. I'm really sorry about that interruption.
No, that's okay.
So
No
both
worries.
of your patellar reflexes were absolutely wonderful. Okay.
Okay.
So now, could you do a squat for me? Could you stand up and
Yeah.
do a squat?
Sure.
Okay. That's okay. Could you just stand with your hands at your sides and your
Yeah.
eyes closed? Okay. There's slight swing, but that is normal for a Romberg test.
Okay.
You may sit back down now.
Okay.
And when you walked in, like I mentioned before, your gait was normal, steady, all of that looked great.
Okay.
So, moving right along, we are going to go into the musculoskeletal portion of our exam, and yay, it's the last section. Okay?
Wonderful.
All right, to begin with, are you having any like pain, limited mobility? Have you noticed anything anywhere in your body that doesn't feel right,
No.
musculoskeletally speaking?
I feel good.
Okay, that's great. With your neck, could you please do this and that? Okay. Flexion and extension. Thank you. That's good. Can you bend your neck like this? And then can you turn? Any of that hurt? Any pain or
No.
tenderness for any of that? That is great. Can you do this with your arms? Like down. Can you turn your arms like this? You put them out like this and turn like this. Good, 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 good. Can you, let me think. All right, so moving right along. Now, shoulders, arms. Can you do this with your elbows and turn them? Okay, how about your hands? Turn around. Good, good, good. Awesome. And now I need to test your strength. So can you please grip both my hands, squeeze them. Okay, so that's a 5. And then now can you please push up and down? Okay. Can you pull?
Yeah.
Okay. And push. Okay, so those are your biceps and your triceps, and your strength is 5 bilaterally on all of those, which is really good. So now, I'm really sorry. Could you stand up and do a squat now?
For sure.
Thank you. Okay, can you do this with your hips? Good. Good,
Yeah.
good, good. Okay. Can you sit? Okay. Does your knee flex and can you flex and extend your knees like this? Can you let the camera see you, I guess? Okay. So put your foot up here. Can you like flex your feet forward, both feet?
Yes.
Okay, forward and backward and like rotate them around. Okay, that's really, really good. And I tested your hamstring and quad strength by having you do a squat, and all of that was 5. And now could you stand up? I'm gonna just inspect your back. Okay, so your alignment looks good. I'm looking for lordosis and kyphosis, and you have none of that. Everything looks exactly as it should be. And you can just go ahead and sit back down. Okay, is there anything else you would like to go over today? Any questions you might have for me?
No.
All right, I'm going to give all this information to your provider, and they will be in shortly. Thank you for being a wonderful patient.
Thank you.